Today we will discuss shortness of breath. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Shortness of breath, medically known as dyspnea, refers to the sensation of not being able to get enough air or feeling breathless. In latent terms, it can be described as an uncomfortable awareness of breathing that may occur during physical activity, at rest, or even while lying down. Signs you might be experiencing shortness of breath. 1. Increased respiratory rate. You may notice that you're breathing faster than usual. 2. Chest tightness, a feeling of pressure or constriction in the chest area. 3. Difficulty breathing, struggling to take a full breath, feeling as if you're not getting enough air. 4. Fatigue, feeling more tired than usual after mild exertion. 5. Wheezing or coughing, noisy breathing or a persistent cough can accompany breathlessness. 6. Changes in position, finding relief by sitting up or leaning forward. 7. Anxiety or panic, feeling anxious or panicked may accompany the sensation of breathlessness. When to seek medical attention. If you experience sudden or severe shortness of breath. If it's accompanied by chest pain, dizziness, or confusion. If you have a history of heart or lung conditions. If you suspect you're experiencing shortness of breath, it's important to consult a healthcare provider for an accurate diagnosis and appropriate management. If someone has shortness of breath, here are simple steps to help. 1. Stay calm. Encourage them to relax. Panic can make it worse. 2. Sit down. Help them find a comfortable position, preferably sitting up. 3. Breathe slowly. Guide them to take slow, deep breaths. Inhale through the nose, exhale through the mouth. 4. Check for triggers. Look for anything that might have caused it, like allergens or strenuous activity. 5. Use a fan. A gentle breeze can make breathing feel easier. 6. Loosen tight clothes. If they are wearing tight clothing, loosen it to help them breathe better. 7. Seek help. If it doesn't improve quickly or is severe, call emergency services or get medical help right away. Always prioritize safety and health. In the hospital, here's what healthcare providers typically do to help someone with shortness of breath. 1. Assess the situation. They will check vital signs like heart rate and oxygen levels. 2. Provide oxygen. If needed, they may give supplemental oxygen to help with breathing. 3. Medications. They might administer medications to relax the airways, such as bronchodilators or steroids. 4. Monitor. Continuous monitoring to watch for changes in condition. 5. Positioning. They may help the person sit in a position that makes breathing easier, like leaning forward. 6. Treat underlying causes. They will work to identify and treat the cause of the shortness of breath, such as infections or heart problems. These steps are aimed at stabilizing the patient and improving their breathing. Here are some commonly used medications for dyspnea, shortness of breath. Bronchodilators, albuterol, a quick relief inhaler used for asthma and COPD. Ipratropium, often used in combination with albuterol for respiratory conditions. Prednisone, an oral corticosteroid to reduce inflammation in the airways. Methylprednisolone, another steroid that can be given intravenously in severe cases. Antibiotics, if an infection is present. Azithromycin, used for bacterial respiratory infections. Levofloxacin, another antibiotic used for pneumonia or bronchitis. Diuretics, if fluid buildup is causing breathlessness. Furosemide Lasix helps reduce fluid overload, especially in heart failure. Opioids for severe dyspnea, especially in palliative care. Morphine can help relieve breathlessness by reducing the sensation of air hunger. These medications are used based on the underlying cause of dyspnea and the patient's overall health condition. People who might be at an increased risk of developing shortness of breath include 1. Older adults. Aging can affect lung and heart function. 2. Smokers. Smoking damages the lungs and can lead to breathing problems. 3. People with lung conditions. Those with asthma, COPD, or other lung diseases are more prone to breathlessness. 4. Heart patients. Individuals with heart disease may experience shortness of breath more often. 5. Obese individuals. Extra weight can put pressure on the lungs and make breathing harder. 6. Those with allergies. People with allergies or asthma may have reactions that cause breathlessness. 7. Sedentary lifestyle. Lack of physical activity can weaken the lungs and heart, leading to breathlessness during exertion. These groups should be more vigilant about their breathing and seek help if they experience symptoms. Now, you need to watch my video on seizures or have a look at heart attacks.